Overactive bladder is a syndrome. It's typically comprised of urinary urgency, frequent urination, leakage of urine associated with a strong urge to go to the bathroom, or waking up several times at night to urinate. You may be surprised to find that overactive bladder is extremely common. 1 in 6 adults will suffer from this. This is comparable to the number of patients that have diabetes. We're not entirely sure what causes overactive bladder, but we think that the problem may be a result of a miscommunication between the brain and the bladder. Both men and women are at risk, and this does increase with age, but patients of all age can suffer from overactive bladder. Overactive bladder is typically diagnosed after a conversation with your physician. I may perform certain tests like a urinalysis to make sure that there's no evidence of infection, or an ultrasound in the office to ensure that you empty your bladder. Once those things are ruled out, we can safely assume you have overactive bladder if you suffer from symptoms of urgency, frequency, urge incontinence, or nocturia, which is waking up at night to urinate. It may not be possible to prevent overactive bladder, but there are things you can do as a patient to help reduce your risk, such as limiting fluids to just when you're thirsty or minimizing your intake of caffeine and alcohol. I think it's incredibly important to see a specialist in overactive bladder because the treatment landscape changes so frequently and more advances in technology are made every day that allow us to better treat patients. In urology, we have a very defined care pathway for overactive bladder. Patients are typically asked to start by minimizing their fluid intake, minimize their caffeine intake, and if this isn't enough, we start an oral medication. If they fail 1 to 2 oral medications, then we move on to what we call third-line therapy. This includes InterStim or sacral neuromodulation, Botox injections in the bladder, or tibial nerve stimulation. I really like to rely on my patients to tell me what treatment is going to best fit their lifestyle. We will have a conversation to decide what's going to be best for you because not every treatment is right for every patient. Satisfaction may vary depending on which treatment you have and how well it works for you. The main thing to remember about overactive bladder is that it is a lifelong problem, and we can absolutely help manage that and manage symptoms, but there really is no cure. And so it's important to understand that we may not be able to make it go away totally, but we can absolutely help improve quality of life. Overactive bladder, while it is so common, is not normal. And if you suffer from overactive bladder, you do not have to suffer in silence. We have multiple ways we can help treat you.